hallmark pathology of Parkinson's disease is a clump protein called alpha-synuclein, and it forms Lewy bodies. This clump protein can be detected in the GI tract of Parkinson's disease many years before the onset of clinical symptoms. It also doesn't like to stay put. It can travel from neuron to neuron, and it's been seen in experimental evidence that clump protein of alpha-synuclein can travel up the GI tract nerves that connect the GI tract to the brain and seed and spread in the brain. It's thought that the arrival of pathology from the gut to the brain could cause neurotoxic loss of neurons and eventually Parkinson's disease. We got interested in the appendix because of its role in the immune system in the GI tract. It's really important for surveilling pathogens and bacteria in the GI, and inflammation and immune responses have a role in Parkinson's disease. There's also evidence in Parkinson's disease that there's changes in the microbiome, the gut bacteria, and the appendix has been shown to be an important regulator of the GI tract microbiome. In addition to that, there's evidence that in early PD cases, there's aggregated alpha-synuclein, the hallmark of Lewy bodies, that is present in the appendix. So we set out on a full-fledged analysis to know if the appendix could contribute to Parkinson's disease. We started off by performing 2 epidemiological analyses. We found that the risk of Parkinson's disease was decreased by an appendectomy occurring many years prior to the Parkinson's disease. We also saw that in rural individuals, the protective effect of an appendectomy was much greater. It was 25% reduction in risk for Parkinson's disease. And then we also saw that in the healthy appendix, there was an abundance of aggregated alpha-synuclein. And that was really quite a surprise to us, to have so much of this protein that's associated with Parkinson's disease to be present in the appendix of healthy individuals, young and old alike. Also, whether the appendix was inflamed or not inflamed, there was just this huge reservoir of aggregated alpha-synuclein, which suggested to us that the appendix could be important in the initiation of Parkinson's disease, but that the presence of aggregated alpha-synuclein, this feature of pathology, wasn't unique to just Parkinson's disease. It was present in everyone. So appendectomy is one of the most common surgeries, but all surgeries come with risk. One of the important things to remember is that we saw changes in risk for Parkinson's disease only if the appendectomy occurred 2 decades before the onset of Parkinson's disease, or even longer. So only early appendectomies were protective. But even still, removing the appendix might change the way that your immune system works and your microbiome works. And so you may show changes for a risk of Parkinson's disease, but you also might change the risk for other diseases that we just don't fully understand yet. So we're really just starting to understand the role of Parkinson's disease and the role of the appendix in Parkinson's disease. A better approach might be to control levels of inflammation in the appendix, as well as levels of this clump protein called alpha-synuclein. And so if you control inflammation and this protein that's a hallmark of Parkinson's disease in the appendix, you might not only target changes in the appendix, but the entire GI tract. And so you might do a more encompassing therapy for Parkinson's patients.